is the choice between life and death. The shortage of resources, we are not looking for publicity. Our priority is how many lives did we save by circumventing or preventing a situation. Fundamentally, I'm a doctor. I work from the perspective that life is precious. Malaysia has been the poster child for health in the region. I'm saying has been previously.
Okay.
Means that you have to make choices. Those choices result in some people losing their lives. And that is a terrible dilemma that you have to face as a doctor.
Welcome back to another episode of Life Confessions. Amazing guests join us. We find out more about what they do as well as who they are. And today with us is a representative of World Health Organization for Brunei, Malaysia and Singapore. We have with us Dr. Rabindra Abeyasinghe. And thank you for joining us today, Dr. Rabi.
Thank you, Terry. This is really appreciated. Thank you for making time and thank you for inviting me.
Absolutely. There's so much to find out about what you do and also you as a person as well. Now, let's start with the man, right? Do you remember the first time you stepped into a community as a young doctor or health officer? What struck you most in that moment and how did it maybe shape your purpose in those early days?
Well, the point is that I am still young, but if I go back, I started a while ago when I was struck by fresh out of school, finished my internship, and I'm talking going into service. And I was struck by the suffering that people undergo, whether it's in hospital initially, and when later on when I went into public health and started visiting poor communities. It just drove home the fact that you got to do something to help these people, alleviate their suffering.
What initially drove you to be a doctor?
Oh, it just fell into place, I guess. It came easy when I was in school. I mean, I liked biology, I liked chemistry, which is not very popular, I know, these days.
Yeah.
But somehow that's what I liked, and that's what I did well. And so the path sort of fitted in. But I didn't sort of visualize myself being a doctor when I was a student in school. But when I went into university, then it fitted in.
You found your way there.
Yeah.
It's almost like it picked you as well because you just found yourself being a doctor somewhere along the way and enjoying it as well.
Yeah, I mean, the enjoyment came a little later. Right? Initially, you are dealing with the challenges. You're dealing with coming to grips with the realities, admitting that there's just so much that you can or you should do.
Right.
And that sometimes is very overwhelming.
Right.
But recognizing that, yes, even you as an individual, you as a single clinician or as a public health person can make a difference for people. And that probably is what drove me to public health. Because as a clinician, I always saw that I can impact one person, make a difference. But when you go into public health, you're helping communities, you're helping many more people.
Right.
And that was the attraction for public health.
When did you realize you wanted to be in public health?
Very early in my career. I'm not going to say dates because that could reveal how young I am. But very early in my career as a doctor.
Right.
Yeah.
Right. So just like 25 years old, like last year. Yeah. Now, what was the hardest lesson you had to learn when you first began working on the ground in disease control? Did it change your approach to medicine and helping people?
Yeah, so like I said, I thought I am there to make a difference. I want to make a difference. But the hardest lesson was everybody doesn't share the same concern. So sometimes it becomes very challenging to convince other people to acknowledge that there is a difference that we can make together,
Right.
that we need to make together, and that continues to be a challenge at whatever level you are in, whether it's national public health, global public health.
Right. Do you find you have to take a lot of time managing people on top of having to deal with whatever crisis that you're dealing with?
Always. And when I say managing people, it starts with your own team. Just making everybody understand that we have a common mission, we work together.
What's your
we should
approach
be
to that?
on the same.
Yeah.
It's all about teamwork. I'm just the oil that oils the machinery, and the team does the work. But having the machine functioning smoothly in one direction, that is important, because that way we can achieve impact. But then beyond that, it's not just limited to the team. It's also about engaging with other stakeholders, convincing them of what's best.
The role that you play is so pivotal and time consuming. It could take away from many people, it would take away from their personal lives, the ability to lead a more family oriented life. How do you find that balance for yourself?
That's the price you pay.
Just accept it.
It sort of comes easy in my family because my wife is also a doctor.
Right.
And we're both quite busy, but we both understand that there is a calling and that we're serving a purpose. So I guess there is an advantage in that and a disadvantage, right? Because there's the understanding that we understand each other,
right? That
we both have our own calling and we need to do things, which if your partner is not a doctor, probably it's more difficult. That's what I've seen.
So both understand that there is a greater good to be served.
Yeah, but then of course there is a price to pay. Right? Like my kids have complained through the years that you don't have time, you're busy. It's an acknowledgement, but it's also a recognition that there is a price we are paying.
Right. And do you have to explain to them so that they understand the sacrifices that are being made?
Now they're big, so they understand.
Right. And some of them are following in your footsteps as medical professionals as well?
My daughter is, yes.
Right. So even more so she understands then.
Yeah, she's beginning to understand the burdens of working as a doctor.
And they must be equally as proud of you.
I guess so.
What's, one memory you can share with us from your time in the field, maybe during a malaria campaign or outbreak response, that has stayed with you, like even after the job was done? Sometimes in the quiet moments of your day or your life, you think back and it still comes back to you or even haunts you.
Well, I couldn't single out one event, but one thing that's always stayed with me is I am deeply touched when I see the suffering of people. And I continue to dwell on what can we do better? How should we work around these challenges that people face?
Right.
And it comes probably because I started my career in public health in a remote rural area in Sri Lanka, where there was very high levels of poverty and a lot of challenges that people faced. But that hasn't actually changed over the years, even after my stint with the Ministry of Health in Sri Lanka when I went global.
Right.
And I worked in so many countries, and the challenges that people face are practically the same across many, many countries.
Right.
At an individual level, at a family level.
Right.
There are huge challenges that families face. And when we look at it at a country level, we probably don't recognize it. But as a public health person, when you go into the field, you do see it.
Do you find that because you were exposed to the medical needs of people who lived with less in rural settings, that it has pushed you even further to achieve more in the role that you're in now?
Yeah, I mean, fundamentally, I'm a doctor. And I work from the perspective that life is precious. And we take the Hippocratic Oath. We want to ensure that we save as many lives as possible, but we also give people the best possible living conditions to stay healthy. Right? Now, we're already talking about not just being disease-free, but about well-being, being able to enjoy life to its fullest.
Yeah.
And that is what the vision of WHO is. And therein is the challenge, right?
Right.
It's not just about providing services to the sick,
right,
but it's also about helping people stay healthy for longer, free of disease.
One of the biggest battles that seems to be waged in terms of health is malaria, right? How is WHO supporting Malaysia's efforts to eliminate like residual malaria, especially in East Malaysia, and what regional collaboration models have proven effective in this fight and this battle?
So just to clarify, I know you're asking a question on malaria because I spent the first 25 years of my life dealing with malaria. We actually succeeded in eliminating malaria from Sri Lanka.
Right.
And then we've sort of duplicated that now, I think, globally in about 45 countries that have been certified malaria-free. Very happy that I just noted 3 days ago we just certified East Timor as malaria-free.
Amazing.
That was the last country.
Right.
But Malaysia, Malaysia achieved malaria-free status almost 5 or 6 years ago.
Right.
And we were very happy about it. But that's human malarias. The problem is that malaria, in Malaysia, you have this problem of zoonotic malaria, or what we call monkey malaria. And that seems to be a huge challenge, especially in East Malaysia. So while you've got rid of the human malarias, this zoonotic malaria continues to spill over and affect individuals.
Right. Tell us more about why it's such a challenge.
Well, because in the first place, you don't get these zoonotic malarias all over the world. They're in very few countries which have a lot of forest coverage. Mm-hmm. It's a spillover from, that's why they're called zoonotic malarias.
Right.
The parasites are usually in apes and monkeys.
Right.
But they do spill over to humans, and that's the challenge. So we are working with the Malaysian government to address this challenge. Malaysia has done amazing work with zoonotic malaria, so much so that we are now in the process of discussing the potential for Malaysia to set up a center of excellence, what we call a WHO collaborating center.
Right.
To address the global challenge of zoonotic malarias, not just here in Malaysia, but also to use the expertise you have to work out solutions for other countries also.
Right.
So that's a process we've just discussed with the Ministry of Health.
Right.
And we are hopeful that we can move to the next stage of designating that center. It's going to be in Sabah.
Right.
In the University of Sabah.
Right.
So we will work with them to set up this global center, and hopefully we'll find solutions.
Right.
Not only to address the challenge of zoonotic malarias in East Malaysia and Malaysia, but also in other countries faced with similar challenges.
Right. Do you find that which is the bigger challenge, or are they equally ranked in your mind when it comes to infrastructure versus knowledge, when it comes to letting people know what to look out for and how to take better care of themselves?
Well, I think we are beyond the stage of knowledge, right? We have generally acceptable high levels of literacy. At least most people know what's good for them, right? But knowing what is good doesn't always translate to the correct behaviors.
To practicing what we know.
Yeah.
Right.
So I use the common examples. Everybody knows that tobacco is harmful. but people tend to smoke, right?
Yeah.
Everybody knows that alcohol is bad.
Yeah.
People tend to drink. And closer to home, everybody knows that sugar is bad, but we continue to take a lot of sugar and sweet stuff. So, but what actually is important is not just the knowledge. The knowledge is important, but largely it's there. But how do we touch that nerve which tells people, I need to make a change?
Right.
My behavior needs to change. I need to exercise. That is important. And that's what we are working with the government, this behavior change, understanding what will actually help people adopt a healthy behavior.
Yeah, that's a big question.
Yes.
Are we getting closer to an answer for that?
Yeah, we are. I mean, and I am quite proud because Malaysia led a resolution at the World Health Assembly in 2022 on incorporation of behavioral insights for better health. We've supported the government in establishing a behavioral sciences unit. We are just now completed, together with the MOH, developing a national blueprint for behavioral science, which we believe will be launched in September by the government. So yes, a lot of work is happening on using and integrating behavioral science into health promotion and communications.
Right. Let's hope we see some of the fruits of your labor soon as well. I'm speaking for myself in that same.
Well,
in that same
you have to be realistic. It's not going to happen overnight. It will require a 5 to 10 year period.
Okay. I look
It's
forward
over
to
long
that
term.
down the road then.
Yeah.
Now, in your April 2024 statement on the right to health, you highlighted telemedicine and mobile clinics, which is something definitely that is necessary, right? How has WHO supported scaling these initiatives, especially in remote or underserved Malaysian communities? How has that progress? Has there been progress with reaching out?
If I ask you a cross question, what's the biggest challenge facing the Malaysian health system? You'd say it's the shortage of health workers.
True.
Right?
Yeah.
So it's going to take time for us to address that. But at the same time, we are in that stage of development where we could look at innovative approaches to provide services.
Right.
And that's where the digital health comes in. That's where the telemedicine comes in, right? Yes, you need to find innovative solutions that we can provide services to people, and it doesn't need to be face-to-face.
Yeah.
Right? It can be done remotely. In many cases, and I'm talking about not first-time consultations, but repeat consultations. If you have, and you can provide virtual consultations for many people who are having chronic diseases, if you have digital health platforms that their reports can be uploaded, actually, you don't need a face-to-face consultation with a doctor, right? It can be done virtually.
Right.
Can you imagine how much of decongestion will happen in the clinics if a lot of those second, third, fourth, 10th time patients are not actually coming to the clinic, but are getting their treatments through virtual consultations?
Yeah.
It's going to make a huge change in the clinics, right?
Yeah.
So it's going to decongest the clinics. On the other hand, the same, if you can provide those kinds of services to areas where you have absolute shortages of doctors, or it's difficult to access places to get to hospitals for remote populations, it's going to be a game changer because you can provide the service without physically going there, without addressing the doctor shortages in some remote areas. And on the other hand, you're also reducing the cost for patients who have to travel to clinics that are quite far away. Right? So it's a win-win. And if you're an environmentalist, you'll say, okay, and you don't have to travel, that means you're reducing the carbon footprint, right?
Yeah,
So,
another benefit.
yeah, so there's many advantages. Of course, there's challenges also because data security,
Right.
establishing the platforms, all of that is important. So we are working with the government. We have set up the guidelines. We are sharing them, and it's up to governments to adopt them to their national situations.
Right.
But this is the way forward, right?
That's definitely one of the factors, the accessibility factor when it comes to the health inequities that even were outlined in the health white paper in June 2023. The other issues that seem to be a factor would include quality of our medical services as well as equity. How do we go about like addressing these issues?
I mean, Malaysia has been the poster child for health in the region. I'm saying has been previously.
Okay.
When you had remarkable progress in bringing down the communicable disease burdens, addressing the challenge of infant, child, and maternal deaths. But that progress seems to have stagnated over the last 10 years. And at the same time, you're faced with an increasing burden of non-communicable diseases now. And so the white paper envisaged a shift in the system. So further advances in universal health coverage,
Right.
which you're doing pretty well, but which you could do better,
Right.
right? But also universal health coverage also means that the quality of care is good. It's equally accessible, and that's the equity aspect, irrespective of whether you live in East Malaysia or on the east coast of Peninsular Malaysia,
Right.
or in Selangor.
Yeah.
And also the quality of the care, right? So that's something that we can continue to strive to improve. And that's what I think the white paper is all about, right? So we initially supported the development of the white paper. It also looks at strengthening primary health care because given the increasing burden of NCDs, the aging population, we need a much stronger primary health care system,
Right.
with strong community outreach
Right.
that would help significantly reduce the burden in hospitals, the crowding in hospitals. And so those are some of the efforts that we are partnering with the MOH. And I must say, the MOH is making its best to do what it can.
Right.
But you are dealing in very resource-constrained settings. And I'm not just talking about human resources, I'm also talking about financing. And so it's not easy because you can't give up something and expand the primary care services.
Right.
Because of the ask and the demand on the hospital curative services.
Right.
You need to continue to keep investing in that.
Right.
But at the same time, you need to find the resources to expand the primary preventative services, because otherwise the number of people falling ill is only just going to increase, and it's going to crash the system. So you have to find this balance, which is not easy.
Do you see a future where our universal healthcare the structure would be strong enough to support all of our needs, where private healthcare would be secondary and not seen as the preferred way to seek out treatment?
Well, the achievement of universal healthcare in Malaysia and for Malaysia recognizes the dual system. So it's not without the private sector. It's in partnership with the private sector.
That's how it works.
That's how it works, and that's okay. But it should eventually reach a stage where the services provided by the government sector are equal, if not better. And that is the case already in some areas, or some specialties, than the private sector, right? But we need an expansion and development of both, because it's only through that that we're actually going to achieve universal healthcare. So this is not about the government taking the full burden and trying to do it, but it's about a better partnership with the private sector,
Right.
recognizing what drives the private sector, but that then means that the government also needs some sort of ability to regulate the services
Right.
and the cost inflations that the private sector brings.
Right.
Right?
We need a population that is very comfortably and large in the middle income that can afford private healthcare, so that not everyone is seeking the government-aided healthcare, right? So how much of this can we does WHO actually involve themselves in when it comes to planning for this?
Well, our core business is with the state public sector,
Right.
but we are also cognizant of the fact that expansion of the private sector will also help advance universal healthcare.
Yeah.
So having the correct policies, and when I say private sector, I'm not talking top-tier private sector hospitals, right?
Yeah.
The key issue for Malaysia is that we need smaller scale private sector hospitals in the smaller cities, right?
Yeah.
Which provide a lot of the basic services. That's actually going to be what will take the burden off the government, right? So when you're talking about the M40, right, we're not saying that the private sector is there only for the T20, right?
Exactly, yes.
So we need to have a private sector which is also probably two-tiered, not the ultra expensive, but a more affordable private sector that can provide something in between to what the government is providing and what the top-tier private sector centers in KL and big cities are providing.
Right.
And that needs to be geographically dispersed so that more people can access those services.
Do you see a growth in the more affordable private healthcare industry?
I'm certainly hoping that is the way the private sector will expand.
You and me both.
Yeah.
Now, if the public health system is a mirror of a nation's values, what do you think Malaysia's health landscape currently reflects about our social priorities, looking at the way it stands now, the way it looks like now? Is it a fair reflection of the people that we are?
Given the success that your health system has achieved, I think it is quite a fair reflection, given the discussions that are happening currently within the country on the need for further improvement and expansion of the healthcare services and access. It's a direct reflection of the compassionate position of the Malaysian mindset, right? About the need to provide services for everybody.
Yeah.
But it's also equally important to recognize as the challenges faced by the medical community, how overstretched they are, and address those issues. And I mean, I'm really glad to hear that they want to accelerate the recruitment of doctors and other cadres. This is a step in the right direction. It addresses this core concern on the need to address the challenges faced by the health workers to improve their work conditions.
Right.
And at the same time, there's a lot that is being discussed and being proposed.
That's good to know, definitely. I feel it would seem like in the world that we live in now, one more issue that healthcare professionals have to deal with, even more so than before, is the dealing with misinformation that seems to spread so fast, while proper medical professionals such as yourself, WHO, are trying to help people with the information that you have that is that is legitimate information, but it's so quick for someone to jump online and spread something that contradicts what you say or what the medical community says. And then there's this game that happens of who can get the right information across, because this misinformation can spread faster than a virus. What do you think health institutions possibly can do differently to regain or sustain public trust in the world that we live in now?
Well, there's multiple things that need to happen. We are clearly at the very early stages where our social media capacity are expanding. But as a medical community, I think we need to be trustworthy. We need to build that trust with the public, and we need to be able to communicate that and articulate that clearly to the public,
right,
and be honest.
Right.
I always tell my team, you need to be honest. If you don't know something, you say you don't know it, right? If there's something bad, you need to admit to it, right? Because that honesty is much appreciated by the public. If you're not honest, you open the door for misinformation.
Right.
But at the same time, it's not just only about what we as the medical community can do. As I mentioned, it's also about how can we better regulate what gets out there in the social media. And with the advent of AI, etc., I'm hoping that there will come a time when unsubstantiated claims that are not a reflection of reality will be weeded out from the social media platforms by their engines themselves.
Right.
And so there's hope for the future.
What is AI but the monster that we created, right? So it's either a monster that can help us or one that could cause more harm. So like you said, it's important for us to regulate, which comes down to who is in charge and who is feeding the information to get involved.
And I wouldn't call it a monster. I would call it a friend.
I'll call it a friend, a big friend that sometimes you don't get along with. Now, in your career, you've witnessed both health triumphs and deep inequities as well, because in the various different roles and different emergencies that you've actually been a part of, what is the maybe one ethical dilemma that has stayed with you throughout your career, like a choice that was difficult to make or that you saw happen in a situation you were in?
Well, the biggest dilemma is the choice between life and death, right? The shortage of resources means that you have to make choices, and those choices result in some people losing their lives, right? And that is a terrible dilemma that you have to face as a doctor, because we don't have all the resources we need, right? And so sometimes you have to decide, what do you do? How do you prioritize, right? I mean, I could talk of so many examples, both from my own individual career or even from a global public health perspective, the access to COVID vaccines, for example, right? So this is an ongoing dilemma, right? How do we come to grips with knowing that if you do X, Y, and Z, you're going to improve people's life, save lives. You know it, but you don't have the resources. You can't prioritize it. And so your hands are tied behind your back, and you know it. So that is a dilemma that you have to live with every day, right?
And you have to accept the fact that in that moment, this is the best that you can do.
Exactly.
Right.
All the time.
How do you deal with making that choice? Do you think it takes a unique person to be able to deal with that?
You do your best, and you console yourself that you are doing your best. But that also means that you have to continually push, right? You have to continually think, can I do something better by innovating, right?
that internal conversation that you have with yourself must be something that takes so much effort alongside the work that you do daily as well.
I mean, it's when you say internal, it's all the time, because it's not. Yes, it is
That dialogue,
internally personal, but then it's also with your team, right? What can we do differently that will make a difference?
Speaking of which, if you had the power, let's say, to radically redesign one aspect of the global health system overnight, you could do this, let's say. What would you change and why if you could make this happen?
There's nothing like that. There's no silver bullet for the problems. There's many things
Right.
that needs to happen, and none of it can be done overnight.
Right. So you've resigned yourself to that. Even there's no point imagining what can't happen.
No.
Right.
It's good enough to acknowledge that things can be better, that we need to come together as a global community, and that we need to work together towards it.
That's very practical, which is exactly why I think you are that makes sense that you're in the position that you're in, to be that practical voice of reason when facing an issue. How do you emotionally reconcile working in a field where, success often means preventing something invisible from happening, like a disease that never happens, a crisis that never comes because you stop it, right? So your success is sometimes seen when the thing is not seen by anyone else. How do you tell yourself you've done a good job?
Well, you can tell yourself you've done a good job, because we are not all the time successful in completely preventing things. Oftentimes, our efforts end up in reducing the scale of a potential problem, right? And then you can take comfort saying this could have been much worse if we didn't do X, Y, and Z, right? But at the same time, there is also the thing that we are not looking for publicity. We are not looking for highlighting a major event or a success. As I said, our priority is how many lives did we save by circumventing or preventing a situation.
Right.
And that, to us, is the biggest value, right?
Right.
That's success.
As it should be, because your success is so clear. It isn't something that the world needs to see. It's you knowing that you've made a difference.
Exactly.
Every year, there are new people joining the healthcare world, whether in whatever capacity that they may join, as doctors, as nurses, as medical aides. If you could pass on and teach them one lesson that they could learn from everything that you've been through for that next generation of global health leaders, if they could draw from your journey, what would that be that you would like them to know to better prepare themselves?
It's not easy. Keep working at it, because it is a long, hard journey. And you need to keep working at it, because if you're already there, you should try to make a difference and not give up.
And you would know for sure, because you've been doing this for a long time, and you, of course, are someone that I'm sure many people look up to, and they've said it to you as well. I'm sure people have come up to you and said that, they admire your work. Do you, when someone appreciates you directly, when they come up to you and say that, they appreciate the work that you do, how do you feel?
I feel humbled. It's a good thing. Doesn't always happen.
Okay.
Right? So don't expect praises and taps on the back.
Well, then I will tell you to right now, we appreciate the work that you do.
No, but the reality is this world is more ready to criticize than to acknowledge. Right? So you have to be prepared for that.
Right.
But at the same time, yes, you're correct. And that humbles me when people acknowledge that we have made a difference.
We've now come, Dr. Rabi, to the rapid fire question part of the interview, where we ask you a question and whatever comes to mind, is the answer that you give. What's the first thing you do when you land in a new country for work?
Well, the first thing I would do is I get my passport stamped. But beyond that, I mean, before I come to a country also, I start trying to understand the context I am walking into. How can I make a difference? Right?
Right.
Because every little bit of information is helpful.
Oh, so it's prep.
Yeah. I mean, it takes a lot of prep.
What's your most memorable field visit? Where was it and why is it memorable?
I really can't single out
Too many.
a field visit that is memorable.
Right.
Because there are memorable visits for good reasons, there are memorable visits for bad reasons. So I wouldn't single out anything.
Too many. Okay. Who's the most inspiring leader you've met through WHO?
Again, I'm going to have to tell you that I can't single out a single leader because I find people inspiring for what they say and they do, and that changes. So and it depends on the context. So in some situations, I find leaders who are very committed, right? And say nice things, and that's inspiring. But then at the same time, there are leaders who don't say but also do nice things without talking, who are doers. And that also inspires you, right?
So better not to highlight one when there are so many.
Yeah.
Okay. Tell us one thing you always carry in your bag on your WHO missions.
There's not one thing that I carry in my bag. I would probably say it's my toothbrush, but I would be not honest if I say I don't carry coffee. I do carry coffee.
In your bag?
Yes.
Like,
because I'm not quite sure that I'm going to get good coffee.
Finally, what does health for all mean to you? If you had to summarize it in a word, what does health for all mean? You can summarize it in a word and then explain that word.
Equity. Equity. Access to good quality, affordable healthcare. Everywhere for everyone.
Do you think it's achievable?
We will strive for it. We are not going to achieve it by 2030. But we will continue to strive to achieve it because I think that's what we need to do for humanity's sake.
When you say it, you give me hope as well. Finally, if you had the opportunity to make one change as Prime Minister of Malaysia for a day, big one, what would it be and why if you could make one change happen?
Well, for me to be Prime Minister, there'll need to be a constitutional change because I'm not a Malaysian.
In this fantasy world.
In the fantasy world, I would certainly like to see more resources going into health.
Well, that's a straight, one-line, direct answer. I would vote for you.
Thank you.
Thank you so much, Dr. Rabi, for joining us today. It's been very insightful and hopeful at the same time. Everything that you say, I hope, comes to fruition because almost everything that you said would benefit not just Malaysians, but it would benefit the world as a whole to see a healthcare system that is more inclusive and also would solve the issue of equity when it comes to healthcare. We appreciate you. Thank you so much.
Thank you very much. It's been a pleasure.
And we will see you in the next episode of Life Confessions here on Shock. Thank you for joining us.